Alright. So nursery reinforcing education with the client with MS, what should we plan to do with them? You're trying to do some teaching for a patient with MS. What should you include in the plan of care? What should they know that is part of their care or function for their disease?
Is this what they say?
Yeah, this is what the patient will say. So which one is correct? They might not have it. So you are reinforcing teaching for patient with MS. What statement indicates understanding of the teaching they say? So that's how you phrase it. What statement indicates understanding of the teaching? Understanding of the teaching. Some people are saying A, some people say B, people are saying C, I don't know. What do you mean, if you really mean it, or it's just like how?
They got a lot of,
This is not something that applies. What are we deciding? Raise your hand if A.
A.
Raise your hand if B. Don't jump on the bandwagon, don't get scared because of them. Raise your hand if B. Raise your hand if C. Raise your hand if E. The answer is A. Look at your book. They should be encouraged to try to maintain their self-care, especially ADLs. We want to maintain self-dependency. Certain ones of them, certain diseases you don't. What's one disease where you don't encourage ADLs? You want to help them with their ADLs. There's one in specific.
stroke.
You still encourage them. It's not in term 4, or is it? We're just talking about comprehensive, what you want me to talk about last week? In what disorder or disease would you not encourage ADLs? Like, would you want to help them with their ADLs?
Seizure?
CHF, somebody said it. Because at this point, their cardiac output is just decreased. Nothing's gonna help it get better. Them pushing themselves is not gonna make their heart better. It's just difficult and very strenuous and fatigue for them. So, help them with their ADL. Again, that comes from the book. You wanna assist them with ADL. Then nothing good will come out of them. Like, they have heart failure, you're like, yeah, the more you get up, the better you're gonna get. Like, that's not how it works. Their heart is just straining and it's gonna progressively get worse. They need a heart. Where does it say group activities? I'm pointing it right out to you. Yeah. It's like number 1, 2, 3, 4, 5, 6, 7th bullet. Now, something that you guys should know, because a lot of people feel that since they learn Foley's this way, they apply the same logic to straight cats. And even though it doesn't say it here in the book, I'll phrase it to you verbally. People can straight catheterize themselves. That means they can grab a straight catheter and they're gonna insert it themselves, okay? And they drain urine and then they just take it out. It's intermittent, just for them to drain urine. And what do they do with the catheter afterwards?
Well, you empty it out.
You use it later. Suck and save, you know? Now, jokes aside, you don't dispose of it. They wash it with soap and water, and they can reuse it. It's not that they're cheap. Yeah, you're not gonna use 5 catheters a day. This is real world. This is real world in ATI. You can reuse the same catheter. It's in their house. It's their flora. They're unlikely to develop it as long as you wash it, because your pee is sterile. Now, it should be, yes, it needs to be. It needs to be, it should be. There should be no bacteria in your urine.
That's why you can drink tea.
That's why you can drink it if you get dehydrated.
It's just
Because you're eating terrible things, that's why. You're asking me,
Hey, if you thirsty,
okay? Now, pee is sterile. Now, irrelevant to right now was something that I saw happen. I try to convince myself that I was incorrect. Like, I try to convince myself like this was not happening. Like, I'm just making this shit up. But I shit you not, I saw a urologist come, see a patient, and she had ureters. Like, so from the, like urology, like, so from the ureters, she has like a catheter so deep in her, it's not in her bladder, it's like directly into the ureter from the kidney. Okay, and it drains urine. And he needed to switch the line from where it was draining into something else to be able to, like, he was trying to put like kind of like a stopper, is what I was seeing. And the little line that was within the catheter, he removed the catheter and just kept the line, and he needed to put like some like, it's like this little device on it. And the little line, it was like a little line, it's like threading a needle almost, okay? And it was such a thing, and so the reason why he wanted that, I remember I was like, that will clamp into it, and it creates a lure lock. The other end is a lure lock, which is what you can connect all syringes and other devices to, okay? Yeah, like a little screw thing. So he was trying to connect the line into it. Now, this guy, this doctor, okay, this specialist, this neuro guy comes in, and he's fidgeting with it without gloves. Okay? And I promise you, he didn't do this before. I swear, like, I try to replay it in my head. I'm like, no, it must have been before he even started to touch the ureter. But it couldn't have been. Because what he would do is, he would grab the ureter, like, there's certain things about it, and then to try to feed, the thing that he was trying to feed into it, he didn't do it. He was trying to, like, do it, and, like, fidget it in, and it's like, I could see his hands getting a little wet, because it's, like, leaking it. I was so disgusted. I was just watching him, and I couldn't help but notice like his Rolex, and I'm like,
that's what you
do you just leave this hospital and just like go on about your rich life, and you were just like nibbling on a urine? I didn't want to ask him because I didn't want. I was like, maybe he's gonna be like, it's. But I was like, is it? What up? I said, is it? Let me tell you, this lady, not long before, had a GI procedure that ruptured, and she was creating feces in all her abdomen.
Oh, no, that should be
she has cancer in her uterus.
That ain't sterile.
So, I'm not saying she had a urine infection. My point is no. No, like, just put on a damn glove. And then about his teeth, using his mouth. Now, I will end it with this. He did do this. He washed his hands before he left. And I was like, I don't know. In any case, headaches. We're not here on an hour yet. We're back past the hour. Alright. Don't worry, headaches is short. They really shortened it up. So, we're on chapter 11, page 43. Headaches can be acute, chronic, or temporary, and there's two things you need to know. You have primary headaches, which have no identifiable organic cause. Meaning, we don't know what's causing it. These can include migraine, tension, and cluster headaches. Secondary headaches are associated with organic cause, such as a brain tumor or aneurysm. And no, you do not have a brain tumor.
Okay.
How many of you thought you had a mental health disorder in term 3?
What was your?
You're like going down personality disorders and everybody's convinced. Alright. Health promotion and disease prevention. Stress management. And a headache diary. Alright, so if they ask for what you will do to prevent, you will stress management, so reduce stress. Now what does that look like? Decrease environmental stimulation. Now, just like the others, classified categories of headaches are with aura or without. Now without aura is pretty straightforward. You don't have an aura. But with an aura, you'll notice that, yeah, so you can have like numbness, tingling in the lips, face, mouth, tingling. You can see visual disturbances like light spots or bright spots. Okay? And you'll develop a severe, incapacitating, throbbing headache that is accompanied by nausea, vomiting, drowsiness. A migraine with an aura lasts about 1 hour. Recovery with pain and aura subsiding, muscle aches and contraction of head and neck muscles are common. So you can see like numbness, tingling, visual disturbance, severe headache will follow, incapacitating like that of a migraine, lasts about an hour. Now without the aura, you'll see that the pain is aggravated with physical exertion. The increase are aggravated by physical activity. Okay, unilaterals, meaning you feel it on one side of the head, pulsating pain, and then you can have photo or photophobia, meaning you're sensitive to light and or sound. Nausea, vomiting is on both. Phonophobia. Persists for 4 to 72 hours. Can occur early morning during periods of stress, premenstrual tension, or fluid retention. Okay, so that's the two categories that you can differentiate with, and you can see the intensity and length of time that the headache goes on can vary from that. Yes? Alright. For abortive therapy, meaning trying to get rid of it. Okay, medications can include for mild migraines, NSAIDs, ibuprofen, naproxen, acetaminophen, metoclopramide will relieve the nausea, vomiting. For severe migraines, you will use triptan. These produce a vasoconstrictive effect. Now, if you notice, there's a thing with the triptans. So it talks. The reason why I point out there is in the book about the vasoconstrictive effect. So if you notice, for a lot of the over-the-counter meds that you can get, like a lot of people for headaches, I was putting out use Aleve. And Aleve doesn't only have naproxen; it comes also with caffeine. And a lot of people drink coffee for it. And caffeine will do what? Constrict your blood vessels. So look at nitro, right? Which a common side effect, or even with Viagra or isodenophil, a common reaction is for you to develop a headache. And these medications dilate your vessels. So with dilation of your blood vessels, they're more likely to occur headaches. And it's that vasoconstrictive effect that can help alleviate them. Now with the triptan, since it's causing that vasoconstrictive effect, it doesn't go into it here. It's a common thing you should know. What's the side effects or the complications?
Chest pains.
Chest tightness, chest pain or discomfort. They'll feel heavy arms. Chest discomfort, chest tightness, heavy arms. Like this usually from chronic coronary artery spasming or constriction. And we should never use this. Yes, but more importantly, pregnant. Do not give it to the pregnant women. And if you are taking it, if you are taking triptans, you need, we call it birth control, but the appropriate term that they're gonna use for you is contraception. Make sure they are on at least one form of contraception. And they say one form because you can use several. Because you might be taking the pill or something, but sometimes people forget. Boom, surprise. You can still use a condom if you're in birth control. You don't see it, but I see people look at me and God bless your heart. It's like condom. Alright, so what about NSAIDs? So we cover some complications here. I always cover NSAIDs because it's like it's not said enough. What will NSAIDs do? Most likely to increase bleeding, more specifically, the GI can irritate it. You can take it with food, right? With food, 8 ounces of water, milk, this helps. Watch out for coagulation medication. They're very irritating. And while it doesn't damage your liver like acetaminophen, what do you check for? Kidney function. BUN, creatinine. Creatinine. And all the gym bros in here goes, who's it say creatinine? That's bad for you?
That's good.
Creatinine, not
So it's
creatinine.
just.
Yeah, it's a lot.
You wanna say that too? You wanna say that too?
Why not? Suicidal ideation. Alright, now, I forgot to mention this in the last one, but so interventions for headaches. You do want to keep this, they call it a headache diary or a record. So when I put headache diary, right? What do you think that implies? What should you teach a client to do? They write down their headache, right? How long it lasts.
What happened before?
And usually the better thing is what happened before. Like what were you doing? What are you doing?
Is it kind of like a secret?
Because you're trying to identify the triggers. You're trying to see what's causing your headaches. So headache diary, okay, for patterns and triggers. Report changes in the headache intensity. Remain in a cool, dark, quiet environment. This is going to be most pleasing to them. And then patient teaching or our actions is that we promote this type of environment. Away from nurse's station, away from all the noise. Okay? Elevate the head of bed if needed. Avoid tyramine. Tyramine causes headaches, like as you see with the MAOIs, it also doesn't help, right? But avoid tyramine. Like we said, estrogen, nitro, these medications cause headaches. Manage anger issues and handling conflict. Get rest and sleep. Avoid the lights, or especially glaring or flickering lights. Monitor your menstrual cycle, as these fluctuations of hormones can cause headaches as well. Intense odors, avoid them, right? Like perfume, cologne, tobacco smoke. Other things they might want to practice, right? Yoga, acupuncture therapy, meditation, biofeedback, these are good alternative therapies. So that's for migraines. The description, the client education, the actions are for both. but we'll go over the expected findings, because migraines, we did aura, no aura, like how they feel, what to expect. But let's go over cluster headaches expectation. No, this is for headaches in general. It's just the expected findings, like the aura, not aura, like how long they last, the intensity. Cluster headaches present differently. Yeah. I think what I want you to answer is, what would you do? And before you do an action, I think you would, yeah, you dig deeper. No one comes with a headache and you're like, all right, into the dark room you go. Like, I say it jokingly, but I think we can take these effects to heart, right? So when someone comes, my stomach hurts, my head hurts, my this hurts, or it tells you that, what should your questions be? When did this start? How often? Does it go away? What do you think caused it? So you start trying to put together, have you had this before? Make sense? So if it's new, hence it goes on to that. It can be dehydration. Imagine if then they're like, no, I fell off the stairs and I hit myself on the rail. So then at this point, you're not going to put them in a cool, dark environment. You're going to run diagnostics, CTs, MRI, right? We're going to monitor their status. You want to keep them close to the station. Seizure precaution. Like, it depends on what is causing it. Now, to more accurately go to your description is, the question will say, patient suffers from headaches, XYZ, they have a migraine going on. What is the priority intervention? Or what can we use to promote comfort? Now it's about what are we going to do? Where are we going to place them? So always read your question, because you can't just assume. Is it this a question now? So questions are usually asking one of three things. Sorry, four. Do you need to assess, plan, intervention, or are you evaluating, or education? Now this is called the
nursing process.
No, I know it's API. What is it? What is it? It's nursing? The nursing process. If you don't think like this by now, you should be concerned. Anytime you look at a patient, anytime you look at anything, this will be so ingrained to you, I promise you, you're gonna look at everything in your life this way. It's a very practical way to look at things, okay? Now the questions are asking whether, right, you're assessing, planning, or intervention. So let's phrase some of these questions. We say a patient comes in, XYZ is happening, and so if they haven't given a diagnosis yet, you're still in the, right? Or what should you do first when it says things like that? There's an assessment, especially if it's not identified. Now, if the problem is identified, okay? Patient has meningitis, they are, right, with a headache, pain, complaining of this, developing a fever. What is your priority action? What is it asking for? An intervention. Make sense? So at what point are you in the nursing process? That should be visualized to you within your question. Now if it is an intervention, then this dilates still into a scale. We're gonna go from least restrictive, invasive to the most. Yes? So when answering your questions, ask yourself, at what point in the nursing process am I? What does the question really want? Is it about education? Is it even about the disease, or is it